All right, Nicole, welcome on the show. I appreciate you coming on.
Of course. Thanks for having me.
So where I want to start is just give me a little bit of background about yourself, tell everybody what you do, and then kind of dig into what got you into that and throughout your childhood, what made you interested in the field that you're in now.
Okay, so I am a pediatric nurse. I work in an emergency room. I've been a nurse for about 13 years. I always wanted to be a nurse. I feel like when I became a nurse, a lot of people were doing it because it was the cool thing to do, but I was always a patient sort of as a child. My health history is a hot mess on paper, so I was that person. And then just figured why not become a nurse. But I just have a passion for helping people and families. Actually, really originally wanted to be a labor and delivery nurse. I love everything having to do with birth and all of the things. But then life goes on. And I had to get a nursing job to get experience first. And I was on a women's and children's unit. And then 2.5 years in, one of our women patients was opening a new unit at a children's hospital and kind of poached a handful of us. And now I've been there for almost 11 years. So, yeah.
So you're a mom of 4 boys.
Yeah.
Did you have all 4 of them while you were already nursing?
Yes. I became a nurse when I was 22 and had my first son when I was 25. Actually, right when I was starting at the children's hospital, I thought I was exhausted because I was working 2 jobs and working days and nights, but really I was trucking through a first trimester.
Yeah, that's awesome. So how has having kids of your own changed the way that you approach your job and how you treat other people's kids when obviously they're entrusting them their most precious belonging to you to take care of?
Exactly. So I think having kids of my own has maybe made me a lot more understanding of certain things. I feel like sometimes with the newer nurses or nurses that don't have children yet, they, especially working in an emergency room, they're like, how could this possibly happen? Like, how could whatever the situation be? And I'm, especially having 4 boys, I'm like, let's relax on the judgment because literally kids can do anything, get into anything like that. I will say when I was pregnant, because of the population that I work with, being primarily with kids and seeing kids with all sorts of, medical problems or just different diagnoses, I kind of was terrified during my pregnancy, thinking that there was no healthy children that were ever born, to where my mom would make fun of me. But yeah.
Yeah. So obviously you've been doing it a long time. How many years in are you now?
13.
13 years in. So you've been doing it a long time. You're obviously well experienced. How have you seen, especially over the past decade with everything that's happened between COVID and all of the sort of politicizing of especially children's healthcare, how have you seen maybe technologically through the parents' perspective, how have you seen the field change and adapt and grow as you've been there?
Well, so that's kind of a loaded question, but
yeah, it is.
COVID's a whole nother topic. It definitely has changed a lot over the years where, this is a multi-part. I feel like post-COVID, I'd say people treat healthcare workers worse, as are my experience. I don't know why exactly, but I feel like there's this much more different mentality when they come into the hospital of, I don't know, expecting us to, they forget that we're also human and just trying to do our best and do our job. We're very short-staffed. There is not enough resources. I feel like that's across the board. I obviously can't speak to every hospital or institution, but I feel like in general, a lot of us nurses are run down. We're overworked. We're underpaid. We're understaffed, all of the things. As far as technology goes, I don't know exactly kind of what you meant, but maybe as far as parents with social media and all the things, they kind of, it's like Google on crack, I guess. Parents go to that instead of referring to their medical providers, sometimes maybe too much, while it also can provide a great place for them to get answers and have that at their fingertips as a resource. It kind of could go either way. Because sometimes in the medical profession, if you don't have a medical degree or any background knowledge on some of the topics, then it might not be so cut and dry.
You mentioned there that you felt like one of the ways in which the landscape has changed is how parents treat you. And obviously, I imagine that there's some sympathy there because the vast majority of people that are coming into an ER with a child, they're scared, they're frightened, they're frantic, and they're probably not themselves. But at the same time, what do you wish that those parents coming in would further understand maybe about the inner workings of the ER, whether it comes to triage or waiting times, that would help kind of soothe their brain and realize that my kid is going to get seen at the appropriate time and they're going to be taken care of?
Yeah, that's great topic too, because we do see that a lot and I don't expect like you said, I know could potentially be the worst day of their life. They're going through things that, sometimes people couldn't even imagine going through. So we definitely, I think, especially working in pediatrics, we're very sensitive to that. We're very understanding of parents. And I feel like more so than in the adult world, we kind of take that into consideration because you have to, and because they know their child best. But as far as the inner workings, I will say that I feel like sometimes people maybe don't really think that we truly have the best interests of the child at heart, and that there is a rhyme or reason to how we're doing things. For instance, if people are like, oh, this person came in after me and why are they getting a room, or certain things, there's a lot of factors that go into our triage process. And also a lot of things that, when you have your child in the ER, you only care about your own child, obviously. I mean, we all would feel that way. We care about our own child. We want to make sure they're okay and they're healthy. We're not necessarily going to worry about everyone else's child. I mean, but that's understandable. But it is our job to look at all of the children in the room, not just your child. It does not mean that their issue is not important, or that we think that you're being dramatic, or that they're not sick. It's just that there's different factors of like what goes into it, and like how stable a child is, that we're able to kind of differentiate. And I know that sometimes it sucks too, but it's like we tell parents, if there is a long wait in the ER, like obviously if they're getting worse or whatever, or if something happens, bring them up to us, we'll reassess. But also, like, clearly if something terrible all of a sudden happened, or if they all of a sudden had a lot of difficulty in breathing or started having a seizure or something, like, then we'd rush them back. And I feel like sometimes parents think like, oh, so they have to get to the point of almost dying before you're going to take us to a room, which isn't the case. It's just that we do specifically hold certain rooms like for extra emergencies. I know everything feels like an emergency, but you know what I mean? So that's kind of why, like, we are doing our best. We're working with what we got, but we generally, especially in pediatrics, like, all of us have a deep passion for caring for your child, and we don't even know your child. A lot of us have children at home that maybe are even sick as well, that we're coming and caring for your sick child instead of our own. So sometimes I understand that people are in heightened sense of emotions, but just be nice to us.
Yeah, you also mentioned there the sort of dehumanization, especially after COVID and with the growth of the internet, of healthcare workers.
Mm-hmm.
How do you think that your social pages that you've been growing have kind of led to more people seeing the human side of healthcare workers like yourself? And then also, what led you to start it? Was it something else? And where are you planning to take it in the future?
So the hope is that it does kind of put a more personal aspect on. I know that there's a lot of healthcare workers out there that are kind of venturing in this avenue and like getting their toes wet, but because I feel like through my stories and through it, like, yes, on my like reels that I'm sharing, I'm usually touching on hot topics with like children's diagnoses or like common ailments that maybe people, like, my goal, I always want to just start with, is never to tell someone not to come to the ER. I never want to make a parent feel bad or feel like we are going to be like, oh, you could have done this at home, because that's never the case. But sometimes, even myself, there's times where I'm like, oh, I don't feel like taking him to the ER. And is it okay for me to stay home? Like, what should I be aware of, And so that was my goal, is to just help parents feel more confident in their own abilities of, monitoring their child or judging whether or not it's an emergency. And now I lost my train of thought about the beginning part of your question. So that, I feel like that helps personalize it a little bit. And then, like, through my stories and when I've seen that I'm a real person, I have my own children that are just as wild as yours. They fall down the stairs, they jump off stuff. They have injuries just like yours do. So like, they get into things, like, it's just hopefully allowing people to realize that we are just real people doing it right there with you, like in the same situations per se, I guess.
Yeah. No, that's a great answer. My personal experience from a lot of the people that I've talked to through the podcast and just in everyday life, people that think about starting a page similar to yours or maybe entirely dissimilar, somebody that starts posting on social media in general, one of their greatest fears is that they'll be judged, they'll be ridiculed. I guess specifically to your kind of niche would be, what if I'm wrong? What if I give misinformation? What were some of the hurdles that you had when you were first starting, or some of the mental blocks that you had, and how did you overcome them? And what advice would you give to someone that is thinking about starting a page similar to yours?
So I actually started in trying to dabble in social media with like digital marketing sort of, and some affiliate marketing, only because I have 4 children. My husband is a full-time firefighter and does construction on the side. So he works his butt off. And it's not always you can't always just like go pick up more shifts or get childcare. So I was like, well, how can I bring in, maybe at first this is how it started. How can I bring in some money on the side? And you saw it all over. It was blowing up all over social media. So I was like, why not try this? Which that was kind of a struggle a little bit. And because I wasn't really passionate about it. I'm not really a salesperson. It's not really my thing. And so I struggled there a little bit, but I think that helped me lead like where I just learned more about social media and kind of like growing or starting a platform. And I was like, why? And I actually had this Peds Nurse page idea from the beginning. I just kind of was scared, I guess, to start it for all those reasons that you mentioned. It's like putting yourself out there in a field that you're an expert in makes you feel extra vulnerable, because what if you are wrong? What if someone does like judge you? I had an incident where at my work this past summer where I did get brought into a whole thing because someone reported it thinking that I was sharing actual patient information or that there was too many identifiers of where I worked or whatnot. And that was a very anxiety provoking situation. But what I've realized is that if you just do it, like get out of your own way sort of and push through the fear, like that you actually everybody has something that they're kind of an expert or that you feel comfortable sharing. And it comes so naturally. I think that's why this page all of a sudden then took off so well, is because it's what I do every day. Like every day at work, I'm just educating and helping families feel comfortable to leave the ER and what to do to come back. And that's essentially what I started doing just on social media to reach a bigger platform. And
yeah, one of the main themes on your page is for parents, as you mentioned, to go or not to go to the ER. And I know, especially for parents, there's a lot of things involved. There's finances, insurance, like you mentioned, time. It can be a long process waiting in the ER, waiting for your turn. What are some of the biggest things that you see in your everyday life that you could give advice towards parents of these are the times when you should go, these are the times that you shouldn't go? And maybe there is a gray area there where you have to use a little bit of common sense and your best judgment to decide whether your kid actually needs professional help right now or they can wait until they can see a pediatrician later on.
Yeah. So I feel like post-COVID also, something that I've noticed with my own children and working in an ER is that it's much harder to get into like primary care type visits or get into your regular doctor. So I feel like we've had a shift, which kind of always was there, but also a shift where the emergency room is used for kind of like sometimes people's only doctor or like the only doctor for their children. And like you said, insurance is crazy, cost of everything. So people come to the ER a lot of times for anything. But what I would say is, first of all, if you're able, like if the ER is at like a 5-hour wait, usually if you're able to wait that long before getting seen, and I know parents don't always know this at home, then usually you probably could wait to maybe go to your normal doctor in the morning. However, there definitely is a gray area. Every child's different. Any situation, like we can give guidelines, but any situation is totally unique because really I can't assess your child through a phone or through whatever. I can't do anything. But I would say, obviously, if anyone has any trouble breathing or what you perceive to be difficulty in breathing, you can Google kind of like what that may look like. But truly, if your gut, I am a huge believer in parents following their gut and their instinct, because I use parents a ton. They know their child best. If they truly feel that there is something wrong, I mean, maybe we'll disprove it and we'll reassure them and we'll say no, that everything ended up being fine. Or sometimes it's like when your car is making a noise and you bring it in and all of a sudden it stops making that noise. Like you're like, I swear at home they looked worse.
Yeah.
So I never want to discourage parents from coming to the ER. However, if you feel like, okay, well, they're pretty much kind of still acting like themselves. Maybe they're a little tired just because they're sick or whatnot. But like, then you could probably watch them. I always do say, try to medicate if you feel comfortable. Like say your child has a fever, we will medicate them, probably, especially if they come in with a fever. That's one of the first things we do. And then a lot of times they sit in the waiting room. They're like, oh, my child looks better. And they want to leave if we're busy because all we did was medicate. And that sometimes is enough to perk them up. So I always say, try Motrin and Tylenol maybe in that scenario, if you feel comfortable, just to see, because your child may all of a sudden start drinking and start playing and be like, oh, I could saved myself a whole, hours long of a visit. Yeah. But I do believe that the parent's gut. So if you feel in your gut something's not right and you like don't want to go to sleep that night because you're afraid something might happen, just come. I mean, what the worst that's going to happen is, like, if your child is fine, is that you wasted, hours of your day, which won't really be a waste because at least you know that your child's fine.
Yeah, now you have peace of mind.
Yeah.
You mentioned there that a lot of times nausea and just general sickness can be one of the causes of people to bring in their children, because that's especially dangerous in children. But are there any typical symptoms or maybe even diagnoses that have been coming in more frequently, or that over your entire time in the ER that you've seen kids come in with the most?
No, not really. Not, I mean, kids come in with everything, but we can get as something as simple as, I don't know, a little a rash, which sometimes rashes can be worse. You know what I mean? I don't know. It's hard to say, but up until obviously loss of life. But I don't know. We've seen a ton of hand, foot, and mouth this year. Even normally I feel like it's a summer thing, but even into the fall. And I will say hand, foot, and mouth is something that you don't need to come to the hospital with if you think they have that, because like there's nothing we can do for it. Unless your child wasn't drinking or something like that, where they were dehydrated. But for the most part, and that type of stuff, we do have, like a lot of hospitals do, and we do as well, have like an urgent care section that we try to, like, when we're triaging kids, if we think that they can be like fast tracked, then we kind of do them over there and kind of treat it similar to like an urgent care would be, which helps a lot of families too, because then usually they can get in and out with either if they need antibiotics or if they don't and they just need reassurance or whatnot and they don't need a lot of tests. That helps.
Yeah. So I want to get into some kind of current event things here, because there's a lot of questions that parents have, and that they want to make sure that even the questions that they have for themselves also apply to their children, because there's different rules for children and adults because their bodies can handle different things. But especially on the topic of vaccines, there is, I feel like, a general fear, especially after COVID. I had on about a month and a half ago, my uncle actually owns a company called AngieX, and they are currently working on the cure for cancer. They think that they have it, actually. It's a cure for all solid cancers, and it works by targeting, I don't want to butcher this. If anybody wants more information, go actually listen to the episode and listen and describe it. But from my very limited understanding, it works by targeting the specific blood cells that attach to the tumor. And so as a result, there's no side effects for treating solid cancers. And one of the questions I had asked him when I had him on was his thoughts on all of the COVID vaccines and everything that happened there. And I don't necessarily know his political leanings, and I know it's been very politicized, but he kind of expressed his disappointment at the way that they were rushed. And he knew that he had colleagues in the healthcare industry that were developing these vaccines. And obviously he's very experienced in developing treatments and cures for things at this point. He was very disappointed to see the people ignoring certain guidelines and precautions to rush out this vaccine that, in his view, wasn't very needed. So because of that fear, all that to say, I feel like there is now not only a fear around adult vaccines over flu, COVID, yearly vaccines like that, but now people also don't want to give them to their children. What is your advice on that? And do you think that people should still be coming in for flu and COVID vaccines every year?
So another loaded question. My personal take on vaccines is that I wholly believe in science, but also obviously I totally also support parents' choice in their child's healthcare. However, if we're just talking about, I agree then with your uncle with a lot of the things related to the COVID vaccine. I don't want to get myself in hot water, but I did not receive it myself, nor did any of my family. I agree with him in the sense of where I felt like it wasn't truly necessary. Now, I know some people believe that saved them or saved their loved ones, and that's good for them, But me personally, I felt like, and how we kind of have seen the progression, I feel like, of COVID since, and I am no expert in the little semantics of diseases I know a general, but yeah, it's been a long time since nursing school too. But what I will say is the progression, the way we've seen is it's kind of similar to a seasonal flu in the sense that we see it kind of peak. Like we had a lot more COVID, maybe, diagnoses in the early fall. Flu we usually see a little later in the season, but for the most part, especially with children, I will speak specifically to children because I during COVID worked only obviously when pediatrics, our hospital was completely empty. We were very slow to the point where they couldn't even schedule any of our full-time staff. We were getting canceled because children just weren't getting as sick from it. So I definitely don't think that your child, now there's always going to be populations that maybe your doctor, and that's a discussion you have with your provider, obviously if you're chronic illness or whatever, but in general, I don't feel that it's super necessary. I do think it was a little rushed. I truly believe in vaccines, most of all the childhood vaccines. Like my children are fully vaccinated in that sense because they literally have proven over time to change the course of certain disease pathways or change like history in the sense of what people used to die from and maybe aren't now. So COVID is a touchy subject in that way. As far as the flu vaccine, I do get the flu vaccine every year. In children specifically, so now opposite of COVID, I personally have seen more children than I can count die from the flu. I know it's like people feel like it's hit or miss because they don't, it's not an exact science of like, oh, this will for sure prevent you from getting the flu, but it is shown that like for the most part, it tends to shorten maybe the duration or the severity of it. But is it something I'm like rushing out to get my children the flu shot? Not necessarily. They have fall birthdays. So they're already having their doctor's appointment, so we do it. So yeah, I mean, like I said, for me, I feel if you were going to choose one for your child, I personally would choose the flu vaccine because I don't think you need the COVID, but that's just me.
Yeah, no, I agree. I think that's a great answer. And the emphasis there is that each parent needs to decide for their own children.
Right.
So I really appreciate you kind of hedging that on both sides, which also exercising common sense, but doing what's best for your child. So the other thing I would say with vaccines is it's been very popularized lately, the early birth vaccines that people get as soon as they come out. And I think it's the HIV vaccine that has been especially highlighted as, do we really need to give our children this? And
it was hepatitis B usually.
Hepatitis.
Yeah.
Yeah. So as far as that goes, are you in favor of, I mean, there's the different routes of you can do it all at once, you can not do it at all, or you can stagger it and do it along the way. What would you do for your children?
So my children did get them because I didn't really, I mean, I know people, I'm the worst because I don't go through all the fine print. I felt like that one has been proven over years. There's not a lot of side effects. Now, well, I know other people may feel differently, but my children did get them. Do I feel, so there's two main vaccines that you get at birth. It's usually the Hep B and then the vitamin K. The Hep B, do I feel like it's super necessary in our, us not being in a third world country and we usually are in safe environments and like how hepatitis is transmitted. No, it's probably unlikely that your child will come in contact with hepatitis B unless you're in like certain situations or certain patient populations. However, the vitamin K shot, 100%, you need to get it for your child because children are born without like having the proper clotting factors yet. I have personally seen, and I know it happens all the time, like from birth is very traumatic on a child, like on mom and baby, and the amount of brain bleeds and bleeding that internally that could happen and they don't have the levels of vitamin K or the clotting factors to stop those bleeds. We've seen brain hemorrhages and things that are just like, it's just not, to me personally, worth the risk of, do I want my, day-old baby to be hospitalized and potentially die or have long-lasting defects from brain hemorrhage, when we could have just, like, there's a reason why we incorporated that. I mean, there's a reason why I incorporated everything, but for me personally, especially, I think vitamin K is extremely important for babies.
Yeah. So the next thing I wanted to bring up was that recently we see I'm trying to think of how I want to word this because I want to do it very carefully. We saw a lot of pregnant mothers go out and rush to take Tylenol in response to the Trump administration coming out and saying that there's studies showing that Tylenol is leading to autism in especially young males. So the thing I want you to speak on is making sure that we don't politicize children's healthcare and that we exercise a little bit of common sense with our children, because even Tylenol came out and said that they don't recommend that pregnant women take acetaminophen. That doesn't mean that Tylenol is bad in any way or that you shouldn't ever take Tylenol, but understand, like, these are the facts of the drug. This is when you should and shouldn't take it. And whether it comes from a Democrat or a Republican, we should listen to the science and not decide what our child should and should not take based on what side of the aisle somebody says something on.
Yeah. So I agree with that. I don't, like I said, I'm not super big on like when this whole thing was an issue. I also don't follow current events super closely because I don't watch the news a lot. I have 4 children. I just don't have time. And like it all, like you said, a lot of things get politicized. A lot of things get blown out of proportion. And this Tylenol, the way we saw it affect us like right away was parents then immediately were refusing Tylenol for their children, which literally had nothing to do with the study. And so it just kind of, social media and politics with healthcare, like you said, it kind of blows it out of proportion. I feel like where you should follow the science, but also like your physicians did have many, many years of schooling and very specialized schooling. And I mean, I would trust them over even me knowing whether or not there was actual risk or not. So I'd say probably talk to your own healthcare provider before assuming that it was bad or safe. For the most part, I know there's people that say they don't want to take anything during pregnancy. I was not that person. Pregnancy's hard. You got to deal with what you can. But so far my kids are all healthy. But I will say, of course, the drug companies a lot of times do have to then cover their own, but by saying like most things aren't ever going to be recommended during pregnancy because there's not usually specific studies. Pregnant people are a high risk population. No one's going to volunteer when they're pregnant to like, yeah, try this on me, usually. So there's usually no pregnancy studies on a lot of things. I'm not saying if there was or wasn't with Tylenol because I don't know, but I just would take the things with a grain of salt. I do think that like when you touched on politicizing children's healthcare, if we're going to swing back to the COVID vaccine, what startled me the most too is during that, and I know it was election year and all those things, but they started having like actual commercials with like Sesame Street characters and like talking about like getting this medicine or getting this shot. And I just felt like that was, to me, made me highly uncomfortable. Like, when have we ever allowed like drug companies or medicines or anything been like, why are we directly targeting the child? Like the child doesn't, like, it just seemed messy and felt icky to me. That's not a scientific term, but that's what it felt like. And so I don't think that things should be used as ammo or used to sway people a certain way. Like everything should be a discussion between you and your personal healthcare provider, because they know you best. They know your history. Some things you have to like look at all sorts of lab values and histories. And, like there's a lot of things that go into making a decision. I don't think that, at least not in emergency medicine, we're not pushed, or none of my providers, I will say, are like, don't have incentives to like push certain things. Like they truly are doing what's best for the child in that moment. They're not like pushing certain medicines or anything because of that. So, I mean, I can't speak to primary care, but I just think it should stay out. It really shouldn't be a part of it at all, I think, of politics.
Yeah. No, thank you for that answer. I really appreciate hearing medical professionals feel similarly in that, maybe not everything should be so black and white. Maybe we just need to exercise some common sense and some judgment over our own health.
Yes.
Moving on to something a little bit lighter. We're obviously moving into winter and we're twilighting fall a little bit here, or at least fall is in full swing. Certainly the pediatric hospitals are going to begin to fill up. A lot of people are going to begin to get sick because it's just that kind of year. What would you suggest to people in general, but also parents who want to take preventative measures to make sure that them and their families stay healthy this winter?
Honestly, kids are dirty and germy and grimy, and they put everything in their mouth and they touch everything. You can try to express to your children, young and old, to cover their mouths and wash their hands, but they're going to get sick probably. Should you avoid certain places? I don't believe that. Like, I think it builds immunity. My children they go to school, they are in the dirt, they're everywhere. And to a certain extent, I don't really limit. I mean, toddlers are going to lick things. It just happens. That's probably where they're going to get sick from. But I mean, obviously, truly, what I think that happened in schools since post-COVID that has helped wasn't the mask wearing or any of that. It was literally the fact that they started, I feel like, with at least what I noticed with my kids, like really pushing them to wash their hands more and more and more. Because that's what, like, the kids just need to wash their hands, and they don't like very much. That's where most of the germ transmission is going to come from. I mean, obviously, if your child is like really sick or like you're hacking up a lung or something, maybe then avoid going to certain gatherings or whatnot. Or if you have like elderly family members or sick family members and your child is just snotting everywhere, then maybe give some distance there. But otherwise, just common sense, like wash your hands, try not to lick people that are sick, and like, just stay, I don't know, do your best. That's do your
wash
best.
Your hands.
Yeah, wash your hands. Try to keep them clean.
Yeah. So something that's been, I don't know if it's a countrywide thing, but I know, especially where I live, there's been some recent cases of measles where kids just come home not feeling great, but it doesn't seem like something ER worthy necessarily. Their parents go to check on them the next morning and they're gone. So I guess, like I said, I don't know if this is something that's been countrywide or it's happening where you're at, but I know it's something that's been really relevant here in upstate South Carolina lately. We just lost two different kids in the area to the measles, and both were similar stories, super active, healthy kids. And then one Friday they come home, and the next Saturday when their parents go to check on them, their kids have passed away. So is there any measures, and it kind of goes back to what we were talking about earlier, but is there any measures that you can take as a parent to know, is this something that we need to go get checked out right this second? Or is this something that we can wait on? And specifically with things that may not present with higher symptoms.
So kids are unique in the sense where they, like adults, if you were to get sick and you were heading to the way where you were eventually going to decline to possible death, it's like a decline, like you see this decline happening. Like children don't necessarily have that. Their little bodies like compensate really well. So they'll compensate until they're ready to just, they're like, my body's tired, and they poop out and then they crash fast. So I could see where that would happen. We have had cases of the measles, even at our hospital. I don't know if we've had any deaths, not that I've been a part of or heard of, but that doesn't mean that didn't happen. The problem with measles is like, sure, we do like screenings when they come into the ER too, but like the screenings are so general, like you kind of said, it's like, do they have a rash? Which so many kids get viral rashes when they're sick or if they're feverish. And then it's like, do they have a fever? Do they have a cough? I'm pretty sure that covers almost every child that's going to be sick this coming winter or ever. And so it is hard to determine. I will say though, usually it wouldn't happen that fast. Like usually you wouldn't just be though, like where there's super mild symptoms and then boom, you don't wake up in the morning. Like that isn't also, and so I don't know the situation with those children or if they were vaccinated. I do believe in that one. I think that it has greatly helped a lot of people and kind of almost eradicated it at one point, or where we weren't seeing cases at all. And now we are. And obviously there's people that can't get the vaccine because of whatever health reasons. But I would just say that like, if your child is not acting themselves, and like, so kids are going to be sleepy. You're sleepy when you're sick. We're going to be kind of not feeling like laying around, but like there's a difference. And usually I would say even without a medical degree, you can sense when your child's like lethargic or altered, not themselves. I probably, if they were acting really out of ordinary, I wouldn't have just put them to bed and hope that, they'll just sleep it off. Prolonged fever usually always should get checked out by a healthcare professional, especially if it's like consistently high every day. And then usually the measles, what people usually die from is like a pneumonia that you get from the measles, and they would have signs of like some difficulty in breathing and stuff. So it's kind of, I know it's like hard, which is why I always say parents can come to the ER whenever they need, because it is hard. But we as healthcare professionals, I'm in a group thread with some other my coworkers who are also moms, and constantly we're sending pictures of our own child or asking questions, because when it's your own kid, your like healthcare brain goes out the window to an extent, because you're like, it is scary. It's scary when it's your own child. You're like, I don't want to make the wrong choice. I don't want to, I don't want my child to die, obviously, but I also don't want to be the one that's like, they're okay. And then something happens. So I would just try to trust your intuition that if your child doesn't seem right, just get them checked out. That's what I think. I mean, because you're right. Like they may look okay and then all of a sudden get severely worse. I mean, if your child, I don't set alarms to check my sick children in the middle of the night, but if you were like concerned, you could always just like make sure you're checking them periodically, just even if it's just peeking in on them. I don't know, that might help put your mind at ease, as a parent. But in those situations, that's awful. That's absolutely awful that happened to those families, because there probably was nothing that they could have done or any warning signs, and they're going to beat themselves up most likely probably for the rest of their life, even though it's not their fault. But
yeah. Last couple questions here. A lot of people that are in your shoes on social media necessarily don't start with thinking that they want to get into media, or that necessarily their face is going to be out there and they're going to have a particularly large audience, but that is the situation that you find yourself in. And I think a lot of people are going to listen to you and rely on your word, and not to put more pressure on you, but definitely what you say, because you are considered an expert in your field, carries more weight when moms and dads that are concerned about their children look at your page and scroll through and give you a follow. So what do you want somebody that is consistently following you and sees the common themes of your videos, what do you want them to, at the end of the day, take away from everything that you're saying? And what's your final message to a parent that is consistently following you and watching you?
So my goal is, like I had kind of mentioned before, is to help increase their own confidence with medical side of things and parenting. Parenting's hard. We have a million decisions about a million different things. So I was just trying to ease the burden a little bit by just giving knowledge, where a parent, a lot of times we Google things where maybe instead of just Googling and not having any reference, like maybe I have that diagnosis or something, information on it on my page, and they could look it up now. And like I said, I'm never trying to discourage someone from coming to the ER, and I'm never trying to pass judgment on any families for feeling any sort of way. I want them to feel supported, and I want them to be able to kind of relate. I have a very sarcastic, dry sense of humor, and I hope they find it funny and relatable, because like, parenting is hard. It's not easy. Having sick kids isn't easy either. And like determining that, I apologize to families if they've had bad situations, because in healthcare, because we're so short staffed, because we have a lot of turnover, I feel like, which we're seeing really a lot in hospitals, like nurses are coming into the field and just don't want it. It wasn't what they expected. I don't know. They're not in it for the long haul. That I feel like sometimes there is staff that gets short with families or short, and like, and so I apologize if they've ever had a bad situation or that made them feel stupid. I've been that way as a patient and as a parent, where I've had a provider make me feel dumb about complaints I may have or concerns. And I never want to make parents feel that way. So I just hope that they feel supported and that they understand that I'm also human. And that while I do fact check and have a lot of knowledge, I'm always willing to admit if I make a mistake or, speak wrong or type something wrong or whatever. And that at the bottom line is, if you feel like something's wrong, get them checked out. I am just someone on social media. Yes, I'm a nurse. Yes, I'm a mom, but I cannot see your child, physically see them. And a lot of times we need to lay hands on your child, listen to your child, see them in person to be able to actually know if like something's actually wrong, so trusting yourself, but yeah, take things on social media with a grain of salt, even from my page.
Yeah. Nicole, thank you so much for coming on. I think any parent that listens to this episode or goes and gives you a follow, which let's real quick, go ahead and plug your Instagram. Where can they find you at?
Oh yeah. So my Instagram handle it's at your Peds Nurse, but like between so it's then _Peds_nurse. And that's Instagram. And then Facebook is also your Peds Nurse, but no underscores, just all one word.
Yeah. Like I was saying, anybody that follows you, anybody that listens to this episode, I think is going to be much more informed about what to do with their child. And I appreciate what you're doing. I want to encourage you and tell you that what you're doing is making a difference. I know a lot of people that follow you feel the same way. So thank you for what you're doing. Thank you for coming on. And I look forward to talking to you again soon.
Yeah. Thank you so much for having me. It was great. I love it.
All right. Everybody else, we'll see you in the next episode.